and they called me Martins Ferry's mascot. They called me Martins Ferry's Marian Anderson because they thought I could sing. I can't sing. I really can't sing. Asked my daughter, one day I was trying to get her to go to sleep and I was singing and she said, "Mommy, if you stop singing, I can go to sleep." So I really learned that I couldn't sing. But I could spend a whole afternoon telling you about what it's like to be the only one in a small town, in a small nursing school, and for they put me in a room up at the top of the building in the corner in the back, and nobody would talk to me. It was just absolutely nobody. And I said, well, if they won't talk to me, I'll just study. So I spent my time studying, and then when I started to get good grades in school, then all the students came to see me because then I spent a lot of time tutoring. And I really liked that, and so that's where I got the whole idea of how nice it is to be a mentor and a teacher, because they would do that. And then the other side of the coin is that while I was in the hospital and people were saying, okay, they gave you a chance and you better not mess up. On the other hand, the blacks in the community said the same thing. They said, they gave you a chance and you better not mess up. And so I was like caught in the middle between all of this, and taking care of patients, I had to be very careful because some patients I couldn't take care of. They wouldn't let me take care of them because they didn't like African Americans. So we went, and I'm sure some of you have experienced some of these things. And so I just decided that I would learn as much as I could and I would give the best care ever, because I felt that caring was important and it didn't matter what color you were or where you came from or how old you were. But I have to tell you, I was taking care of a little pediatric patient, and he had his appendix removed. In those days, you stayed in the hospital for 7 days. Again, the insurance companies would go bananas, but for 7 days. And so I got to know him really well. So I came in one day and he said, "Nurse, if you washed and washed and washed and washed and washed and washed and washed, would you be the same color as me?" And I said, "No, you have to know it doesn't wash off." But it was just some of those kind of things that said, you know, the important thing was helping him feel better, and I had this really nice relationship with him. So you know, as I said, I could tell lots of stories.
I'm going to move you along
Sure.
a little bit.
Can I tell them about
I
the
want to
park?
get you to the big city, Cleveland, Ohio. To some people, that's a big city, folks. So,
It was big.
being at City Hospital and the Cleveland Psychiatric Institute as a young nurse and moving into leadership roles there, and some of the mentors you had to talk about that.
All right. I left the small town. They did not want me to leave either. And I left the small town and I came to Cleveland because I told my parents, I need to continue my education. Because at the last day of class in this diploma program, the director of nursing said, some of you may want to go on to college. And we all said, why? We're RNs. We don't need to go to college. And she then went on to explain that there was another level. So then I went to my father and I said, I am going to move to Cleveland. Because I had been to Cleveland anyway, because I was on, we had to affiliate to Cleveland for pediatrics and psych and TB and communicable diseases, and some of you may remember that. And so I liked Cleveland. The nursing school warned us, though, that if we came, we needed to be very careful because we were girls mostly from the farm. I wasn't from the farm, but we were lumped together, and she said, when you get there, there's going to be men waiting like vultures on the steps of the nursing dorm for you naive little girls. So when we got there, we said, where are they? Looking and looking for, where are they? So that's how I got out of Martins Ferry. I said, I'm going to go back to school, and my father said, fine. And so I came to Cleveland, and I had to decide what area of nursing I wanted to go in, because I liked them all. I liked OB, I liked pediatrics, I was a disaster in surgery, but I still like surgery. And back in those days, and I liked OB also, but you were always on call as a student because students really ran the hospitals back in those days. I mean, I scrubbed for about 100 babies, you know, over time because that's just what you had to do. You get called out at night and so on. And I liked surgery in the sense that it was dramatic to see some of the changes that happens when you have a surgical patient. Except one night I was called out for a gallbladder on a 70-some-year-old man. It's another older patient. And I thought, boy, I'm sleepy because we were not allowed, if we were called out, you didn't get the time made up. You had to go to class the next day in a diploma school. And so he had a hot gallbladder. And the doctor decided that, and I said, well, this is good. All he has to do is clamp here, cut, and we'll be out of here. Because you could see it. It was just as bright red. And so the doctor said, I want to see how friable this is. And he touched it. So you know what happened. It exploded everywhere. So we spent all night, you know, using ABDs and sopping him up. And then we had to clean the room because it was a dirty room. I got home like at 6 in the morning. So I remembered those days. And so I decided to go to Cleveland. And I decided I'd be a psychiatric nurse because no one else liked psych in my class, but I did, and so I thought I had some obligation to go to psych. But I missed med-surg, so what I did was I worked days in psych, and then evenings I worked across the way at Metro doing OB, med-surg, all those kinds of things that because I really felt that I needed to keep my hand in that. It didn't last long, but for a couple of years I did that. And then I went to school part-time at Case. And I started at Case Western Reserve on a part-time basis while I worked as a psychiatric nurse. So I went into psych. I liked psych really well. I was a staff nurse for a little while. And then I became a head nurse. And that was a very interesting experience because first of all I didn't think I could be a head nurse, and then I became a head nurse and I found that I liked it. Was on a male psychiatric unit, and psych in those days was very different. You know, it was back in the days where people did insulin therapy and lots of shock therapy.
Before Thorazine?
A lot of Thorazine. Oh, it was before Thorazine.
Yeah.
I remember when they introduced Thorazine, and I remember when they thought 10 milligrams of Thorazine was a lot of Thorazine. I also remember that they didn't know what to do, what some of the reactions would be from Thorazine, and they had the dystonias, do you remember those? And they didn't know what caused it, and some of the people had lobotomies performed to stop the dystonias because we were that ignorant in terms of the medicine in those days. So I went on to be a supervisor, and I worked nights, and then I decided to become I was a supervisor when I heard of the National Institutes of Mental Health. And I had just graduated from Case, and I had my BS degree, BSN, and I decided, well, I think I'll write for an R01. And and so there was a psychologist there, and his name was Ishiyama, and he said to me, well, that's not a bad idea. He said, I'll help you. Let's get together and do this. And so I did that. I sent a grant into the National Institute of Mental Health, and guess what? It got funded. So when you think you have to have your PhD and a postdoc and so on before you get funded, that's not really true because there's no rule there that says it's only the science that they look at. So I was funded for a 5-year grant it was a demonstration grant to determine if in a psych setting you could have a model staff where you'd have RNs and you'd have psychiatric aid too, you had to do aid education and so on. If you had this model unit, how much better the treatment would be for patients on that unit. And then it also became an orientation unit. And it worked out really well. All the staff wanted to be on the unit. And we had a hard time because people then began to mimic what we were doing on that unit. And you know how research goes. But it was an interesting thing. But from that experience, I decided I needed to go back to school and get my master's degree. And the project was going really well, and so then that's what I did. But even then, I had this feeling that I would not be able to get through the master's program at Case. And I had to go to Case because that's where it was in the city, and I could go there easier. And I said, I don't think I'll be able to get in the program. So I worked with a priest, and at that time I was director of nursing education. And I worked with the priest, and I said to him, what do you think? Do you think that I could pass and you know, make it through a master's program? And he said, well, now he didn't tell me to pray either. He said, I'll give you an intelligence test. And I'm not kidding. He brought in, which one was that? The Welsh? Brought in a test to my office, and I took it. And he said, you know what? You missed some of the easy ones, but you got the hard ones. He says, I think you can go. And that was my barometer for going to Case. And I did enter their program. They did take me in. And at that time, they had a psychiatric stipend. Some of you remember those? Where you got paid to go to school and you had a stipend. And I still worked because I loved the experience and I liked the clinical, but I worked all while I went to school to get my master's. And like psych, I studied, my thesis was on authoritarianism, looking at nurses and staff in hospitals. And I found that head nurses in the old state psychiatric hospitals, you know, trying to see which was the role model, and they were more like the aides after a period of time. It was really fun. It was a time 1, time 2 study that I did. Now, I have to tell you that in the master's program, when there weren't very few well, there wasn't any African American when I was there. And again, I did experience some of the racism that you begin to feel like. How did you get into the master's program? And I had a really tough mentor for my thesis, and that was Dr. Mary Adams. And some of you may remember her. She was one of the first gerontological nurses, and she was really tough. And she said to me, because of who you are, you have to do a better thesis than anybody. And she says, so therefore, you're going to do a time 1, time 2 study. Well, you know how hard that is, you know, to do a time 1 and then a time 2. And I thought I was going to die. But somehow I got through that, and it was a really nice study. I had lots of subjects, and I looked at authoritarianism, and that's how I found that nurses move more like the aides than the aides did toward the nurses. And so that was my experience in doing my thesis. So at the end of the master's program, I had a job to go work at Fairview Park, and I was really excited about it because Fairview Park, when I was director of nursing education at Cleveland Psychiatric Institute, we had 11 schools of nursing affiliating there. And we had, they stayed for 3 months. It was back in the day. And so I got to go to every time the state board came, I had to go, you know, for their particular school. So I got to know state boards really good, what they were going to ask and those kinds of things. So I was prepared to go work at Fairview Park and the school of nursing there when I got a call one day from Rosella Schlotfelt. And Rosella called me down and said, okay, I like what you've been doing. I've been looking at your grades, and I think you can come on the faculty. Well, I can come on the faculty at Case because they didn't have, they had one African American at one time on their faculty. And I said, oh no, I can't come on your faculty. And she said, absolutely, you can come. And I said, but I have a job at Fairview Park. And she said, doesn't matter. You come and work here. She said, now, I'll tell you one thing, I can't pay you very much. And that was really true. But she said, you'll learn from the experience. And so So that's what I did. And I did come, went home and asked my husband what he thought. And so he said, well, you know, if she says that she thinks you can do it, then I think you ought to do that. So I went on that faculty, and my first job there was as a psych nurse integrator. Anybody know what that is? Remember, you're a psych integrator?
Us old-time psych nurses are shaking their
Right. And that meant that, and that was my job, and I went into the hospitals in the med-surg, pediatrics, and worked with the staff, helping them to understand the psychological aspects of whatever illness the person happened to have. So that meant I had to learn a lot about the illnesses. But the funny thing about going there, I can remember going on the unit, and it was new, and they said, well, who are you? And I said, I'm the psych nurse integrator. And they said, hey, we got civil rights here. I don't know what you're doing on the unit. They didn't understand, but I was looking at the emotional aspects of all the different illnesses. And I learned from that, and in terms of looking at leadership, I thought, gee, I got calls. Like, I'd get 300 to 400 calls a month to come to different units because there was some crisis that they couldn't handle, or some patient that they thought should be sent to the psych ward. That was one of the big things that they would do. Like, they had a 52-year-old man once who had a colostomy, and the colostomy was to be, I mean, in 6 months they were going to fix it, but they didn't tell him that. Nor did they tell him he was going to wake up with a colostomy. So here you had this businessman who woke up with a colostomy crying. And it's because you know how colostomies can be a mess. And he was crying and rocking back and forth and sucking his thumb. And they called me and said, we've got a case for you. And I remember, and I saw the man, and I thought, well, at least you could clean him up and tell him what's going on. They said, no, 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 he's sucking his thumb. He's a grown man, he should go to psych. And I said, I don't think he should go to psych. So I went in and talked to him and explained to him what had happened, and they cleaned him up because, you know, they were just bent on sending him, and he did fine. I mean, it was just the whole idea that trying to help them to know that people need that human, caring touch to help them weather some of the kinds of things that can happen to you when you're in a hospital. But I was tired because they called me, you know, 3 or 4, I was just flying back and forth. So finally I decided I would set a time to go to the units, and there would be set times. And we could go to the unit and bring them together as a group and talk about whatever they thought was a problem. And it worked out really well. It reduced the number of times I got called. The staff learned a lot about that. They called me for things like a patient with sickle cell anemia. They really called them sicklers. They didn't like them. They pretended they had pain when they really didn't have pain. So I got a physician to come in and explain to them the physiology of what happens with sickle cell anemia. Those kinds of things that were really satisfying to me as a psych nurse integrator.
If I can move you another
Sure.
time? Okay. You're at Case now, and
Yeah.
you know, certainly Mary Adams was someone who was part of your growth and leadership, Rosella. But if you talk a little more about those years at Case as you moved along through your PhD and working with your research and leadership roles in the faculty.
I'll do that. In psych, then I became a